My name's Ed Ferrari. I'm the director of CRASER, and it's my privilege this evening to welcome you all here and to introduce in a moment our speaker this evening, Professor Chris Dayson, who is giving his inaugural lecture. Inaugural lectures are an established tradition in academia, as you know, and with the sort of understandable disruptions of the last years, and now coming back to a position where we feel more comfortable gathering together, we're really pleased to say that inaugural lectures are back again on the university's calendar, and Chris has been outstandingly willing to sort of put himself forward to give the inaugural lecture, I guess, of this new refreshed series. CRASER is one of the UK's leading applied policy research centres. It's been established for over 35 years. I was joking outside that nobody quite knows exactly when it was established, but I think we can safely say it was over 35 years ago. It initially focused very much on people and place-based policies associated with regeneration programmes of the day, but the world of policy has very much moved on. The world of government has very much moved on. The world and society has obviously evolved tremendously in that time as well, and so has CRASER, and in two specific ways, I would suggest. Firstly, as a research centre and as a group of academic researchers, we work much more closely with and on issues about the voluntary and community sector, which was much more of a niche, I suppose, 35 plus years ago in terms of policy salience. And CRASER, I think, is a prime locus within this university of research into the voluntary and community sector and with the voluntary and community sector. And that position contributes to us being one of the UK's leading academic research centres working on voluntary and community sector issues. The second evolution, which is I think equally important, is that academia and social science in particular has had to become much more, and quite rightly, become much more interdisciplinary, building on our expertise of place-based policies and thinking about the impact of the world of policy on disadvantaged people and places means that inevitably we want to lend our expertise and also draw on the expertise of those in other disciplines, particularly health and well-being, for example. And it's I think it's it's been inevitable that we've sort of moved into new fields like health and well-being, where social science, I think, has largely been untapped. That's meant that we work ever more closely with colleagues throughout the whole university, including in new initiatives or relatively recent initiatives like the Advanced Wellbeing Research Centre in the university that Chris has had a very key role in its first 3 years. And so that brings me to Chris, because Chris has been one of, if not the prime instigator in those two evolutions that I just spoke of in the way that our own research centre has developed and the impacts that it has. And just a little bit sort of personal reflection. Chris is just one of those people that everyone knows, I think I've found in my job. I've lost count of the number of times that I might be speaking to a civil servant or somebody involved in a research project on something completely unconnected. Last time it was something as prosaic as buses, and I'm not joking, and then a civil servant in that discussion says, "Do you know Chris Dayson?" And I said, "Well, yeah, as a matter of fact, I do." And of course, that is very much testament, I think, to Chris's impact, his reach, and the way that he portrays the salience of his own research into fields well beyond those that he might have sort of initially worked in. But I suspect it's also something very much about Chris himself and his attitude and his positive can-do approach and his outlook, and just being a thoroughly decent person and thoroughly decent colleague. And of course, that just means that he sticks in the memory, and so many people around and about know who he is and know his work. So I'm really delighted that you've come along this evening to hear from Chris, and a particular welcome to Chris's friends and family, and many colleagues from this university and elsewhere, colleagues past and present. You're all very welcome. And I would just, before I do hand over to Chris, like to extend my thanks to those in the university that have made this evening possible, through their hard work and their generosity. And in particular, I would just mention our human resources department, and in particular Sam Coolby there, who's been very much a driving force behind getting these inaugural lectures series back in place, and the university's events team, especially Laura Beach and Fern Jack Smith, and my own colleagues in Crazer's team, particularly Emerald Toft, and also thanks very much to two interpreters that we have this evening as well, making life a bit easier. To all of you in the audience, most of all to Chris for his immeasurable contribution to our work. Thank you also. And I think that just leaves me to say that it's over to you, Chris. There will be time for questions at the end, but enjoy the next nearly an hour, I guess. Thank you.
Thanks, Ed. Yeah, hopefully I won't prattle on for too long, and we will have time for questions at the end. If not, happy to have a chat afterwards about this and other things. I thought it might be quite fun to break the ice and start with a quiz. I bet nobody was expecting that, were they? It's a bit of a niche quiz. It's called "Whose Line About Value Is It Anyway?" I guess you can tell when I grew up from the name of that quiz, child of the 90s. So yeah, I thought I put some quotes up about value, and I'll see if anyone can tell me who actually said these things. Just shout out the answer if you think you know it. Don't be shy. So the first one, this is an easy one, I think, I hope. A cynic is a man who knows the price of everything and the value of nothing. Anyone want to say who said that? No? Surely somebody. That was Oscar Wilde. That was the easy one. So this might not go too well. Price is what you pay, value is what you get. Anyone know who said that? It's from a completely different time, a completely different field. That was Warren Buffett, the billionaire investor. I found myself quite concerned that I kind of agreed with that, but I don't necessarily agree with anything else that he does or has done. But there we go. Strive not to be a success, but to be of value. Anyone know who said that? No, that was Einstein, interestingly. And then the final one, your value doesn't decrease based on somebody's inability to see your worth. Anyone know who said that? I'm not surprised because that's anonymous, and I think that was invented by the internet. Because if you go to a gift shop in Meadowhall, you'll probably be able to buy a mug or a T-shirt with it on. But actually, of all the quotes, that was the one that kind of resonated with me the most, and kind of resonates with some of the things I want to say today. So there's a serious point in there, which is actually value, or kind of exchanges of value, people kind of sharing their value with each other, is what is something really important that helps the world turn. Value is about more than money. It's intangible, it's contested, it's political, and I don't think we discuss and debate it enough. Hence the title of tonight's presentation. So I thought it might be interesting to maybe just share a little bit about how I got here, and how I came to be stood in front of you prattling on about value and doing quizzes that nobody knows the answer to. So I had I guess what you might describe as a non-traditional route into academia. I didn't do a PhD. I haven't got a PhD. Probably won't ever get one now. And I started out studying politics at the University of Leicester, and kind of decided that a career in the civil service was what I wanted. I spent 4 years at the Foreign Office doing stuff on Balkan policy, but decided actually you can't really do much in the civil service to make anything change. And there are other opportunities I wanted to explore. So I then found myself at Voluntary Action Rotherham, and I just seen Shafiq is at the back, who's one of my colleagues from back then. Thanks, Shafiq, for coming along. As a researcher and kind of policy worker, looking at voluntary sector stuff, and it was there that I first came into contact with Crazer. Anyone been around long enough to recognise the old logo? And in particular, a couple of colleagues who I'm really pleased to hear today, Rob McMillan, where's Rob? I can't see Rob, and Sarah Pearson, who I actually worked with before I came to Crazer. And then I got a job at Crazer. I was only supposed to stay for 18 months and I haven't really left since, which is a familiar story, I think. I think it's often described as the Hotel California, in that you can check in whenever you want, but you can't ever actually leave. And then for the last 3 years, as Ed said, I kind of spent some time seconded to the University's Advanced Wellbeing Research Centre, trying to get interdisciplinary research off the ground on the topic of wellbeing, and taking forward some of my research ideas through that route. And that's been a really great opportunity as well. So what I want to do in this presentation really is kind of reflect critically on those 15 years of researching voluntary action, because often as academics and researchers, we kind of represent the latest report and we share the findings and we write the latest paper, but we don't ever get a chance to look across a kind of a body of work. So it's been really interesting for me just to take some time doing that. And I realised I've got the axis wrong on this graph. It should go left to right rather than right to left. I hope there's no statisticians in the room that are. So yeah, kind of started out doing some work with Peter Wells on social investment, and then I've done lots of work on social prescribing, then more and more work around health, work on small charities, small community organisations, healthy ageing. And then during the pandemic, we did lots of work on the pandemic. And what I want to do is kind of reflect critically across all of that work, because one of the really great things about working somewhere like Crazer is that we do the research, but we get to spend some time in some really interesting policy and practice spaces. And I think there's much those reflections that I want to share today as it is the actual findings of the research, because you can go away and read those at your leisure. So yeah, so if I'm going to tell you about my research, I probably need to tell you about how I approach my research. So I would describe myself as a mixed methods researcher, very pragmatic, and I have a very applied policy and practice focus. What does that mean in practice? Well, it means I am interested in numeric quantitative data when it's good quality, when it's robust, because that gives us some really good insights into kind of the what of social phenomena. But I also see real value in narrative qualitative data, because that gives us the why and how, particularly as in recent years, I've become more and more interested in the idea of context and mechanisms that kind of drive change. And we really need both forms of data to do that. I also really strongly believe that research should be collaborative. It's not something that we should do in ivory towers. It's something that we should do in teams, and we should do across sectors. And those are really the things that have characterized my research, I hope. I now want to, before I get into the detail, I just want to issue a bit of a disclaimer, because I do have a kind of a worldview that is broadly utilitarian, which means that I like the idea that we and our governments should really always seek to promote well-being. So the core idea there is that we should want all lives to go as well as possible. Nobody's well-being counts more or less than anybody else's. I'm not going to go into any more details. There's a really useful link there to a website that gives some really interesting resources and oversight into utilitarianism as a way of thinking about things. And I'm going to return to that idea of utilitarianism kind of throughout the presentation. So I thought it was helpful to put that up front. So I guess, number one rule about doing work on the voluntary sector is don't try and define the voluntary sector. That's the first thing I tell PhD students in supervision, but I'm going to do it anyway. So what do I mean by the voluntary action? What I'm really talking about, and there are other ways to think about this, I'm really talking about the work of the voluntary and community sector, particularly the local voluntary and community sector, which I think is characterised by 6 common features. And this is the NCVO definition. First of all, we're talking about formal organisations. They're registered as charities, they might be social enterprises or community interest companies, but they're formal, they exist. A lot of them are registered as companies as well, but they're independent. They're independent from the state, and they're independent from other private interests. They are non-profit distributing. They don't make money for anybody. If they make a profit, if they make a surplus, they invest it in the community or in their social mission. They're self-governing. They have a board of trustees that makes sure that they kind of meet their obligations. There's usually some element of voluntarism involved. So they have volunteers. That might be voluntary board members. It might be volunteers doing the day-to-day work of the organisation. Some of them will almost be entirely reliant on volunteers. Some will have fewer volunteers. And then finally, they serve a public benefit. This is actually written into the law around charities. They must exist to benefit the public. But the reality is, I think a lot of people here are kind of here for the voluntary sector conference tomorrow. And the reality is actually it's a messy, contested, overlapping field of organisations, peoples at different scales, different networks, all sorts of things. I think that's okay. I think that's what makes the voluntary sector interesting. It's why we're interested in researching it, and we embrace that messiness. We don't try and get rid of it. I want to say a little bit about voluntary action and the state, because that's something that, again, that's a theme that runs through this presentation. And we have numerous theories of voluntary action that define voluntary action in relation to the state. I was reflecting to a colleague the other day, actually, I'm a little bit concerned about presenting this, because most of these theories are written by dead white American middle class guys, and I think voluntary sector research over the years has had a bit of a diversity problem, and there's probably something about we need to expand our worldview. But this is what the dead white American guys think voluntary sector is in relation to the state. So one reading is that the voluntary action is needed to address state and market failures to provide collective good. So when the state can't meet people's needs, voluntary action steps in. Another kind of reading of that is that state partnership is actually needed to address failings in voluntary action. Voluntary action isn't perfect, it falls down sometimes, and that's where the partnership with the state comes in. Either way, what you have is a relationship that's mutually dependent, and voluntary action can fulfill a variety of roles over time and in different spaces and places, and they might be complementary, they might be supplementary, and they might even be adversarial to the state. Across these theories, theme of kind of the comparative advantage of voluntary action over state action is either stated, assumed, or inferred. So there's something inherent about voluntary action that means in some circumstances, for some people, it's better at addressing need than the state and always will be. So what we take from that is there is value in voluntary action. Everybody agrees. So what is the value of voluntary action? Does everybody know what ChatGPT is? Is there anyone that's been hiding under a rock for the last 12 months and doesn't know what ChatGPT is? If you have, or if you spend your whole life on your phone, it's an AI program that you can access on the internet, and you can put any question in it and it will use an AI algorithm to answer any question. It's caused quite a lot of concern and alarm in academia and in education because it raises kind of concerns around plagiarism, or it might what if it just makes stuff up? So I thought it might be interesting though to put the title of this presentation into ChatGPT, just to see. I thought I was being a bit smart here, and that actually what it would do is give me a definition that I could critique. I actually did the opposite. So what it said was the real value of voluntary action is multifaceted and goes beyond mere economic metrics. While contributions can be quantified, the true value of voluntary action encompasses a range of social, community, and personal benefits that extend far beyond monetary measurements. I'm pretty sure anyone that's either involved in the voluntary sector, in voluntary action, or has been researching it over the past few years, you'd probably swing behind that definition. It's quite good. It was quite surprising. ChatGPT then goes on to identify 10 components of the real voluntary action: social impact, community building, personal development, well-being and mental health, civic engagement, innovation and creativity, advocacy and awareness, the multiplier effect that kind of impact accrues over time, the fact that it bridges gaps and divides, and the contribution it makes to culture. If I was going to look at findings from across those different reports I've been involved in over the years about the value of voluntary action, you could probably find something in one of these impacts in those reports. So ChatGPT is better than I thought it was going to be. And this is the final quote here that kind of sums it up. So it says this is the kind of concluding sentence. While it can be challenging to quantify the full scope of these non-economic benefits, they collectively illustrate the true value of voluntary action. It's a testament to the power of individuals and groups coming together to make a positive impact on their communities and the world. So ChatGPT knows its stuff. It's clearly been reading all of the research that has been published in Voluntary Sector Review and by people from VSSN over the years. But that also got me wondering, if ChatGPT can uncover the real value of voluntary action, and we all in this room agree what it is, Why is our government incapable of doing the same? So it's actually given me quite a lot. So essentially, I want to try and answer that question for the rest of this lecture. Offer some thoughts and some solutions. So the first thing I did, I thought I'd just go back and look at some kind of different government publications over the years. So this was published in 2007. It was, I think, commonly known as the Third Sector Review. It was kind of new, probably a high watermark for many people in terms of third sector policy and investment by the then Gordon Brown, I think, government. It was around I can't remember quite when Gordon Brown and Tony Blair changed over, but it was around that time. And what they say is evidence needs to focus on the value that the third sector add when they work with the public sector, the value that the third sector bring to actual processes of service delivery, distinctive or higher quality outputs of service delivery, a value for money argument views in the sector, and the distinctive comparative value that the third sector bring when they work with the public. So back then in the New Labour days, they're clearly putting value for the public sector as the forefront of their value for money, as a value argument for voluntary action. The value for people and communities is a secondary consideration. This was then published 10 years later by, I think, Theresa May's government as a civil society strategy. We've lost the third sector. We're now talking about civil society, but that's probably kind of superfluous for this debate. And they take a slightly different view, but they're still here talking about kind of problematizing value and the sector. So they say we want to explore the best means of measuring the well-being of communities and the social value created. However, there exists a significant knowledge gap in terms of what make some communities thrive. So they're problematizing again this idea of what the value of voluntary action is. And then finally, earlier this year was this publication. This wasn't actually put out by the government, but it was very much talking to a government kind of audience. And a lot of the people that were kind of influential behind it had had previous roles in governments and things like that. So what they say is large swathes of the benefits created by civil society also go unrecorded in financial terms, meaning that it tends to be undervalued and can be easily overlooked. They then go on to advocate more measurement, and particularly measurement of the value created and investment in robust quantitative data about impact. So some critical observations of that are kind of those three documents and policy in general over the last 15 years is that across the spectrum, across the political spectrum, there seems to be almost universal recognition of the value of voluntary action, but the emphasis is very much on demonstrating value in financial terms, value to the economy, value to public services. Individual value and community value tends to get equated to public sector value, and certainly there's no well-being discussed. There's also this consistent concerns about the evidence base. We need more evidence, we need better quality evidence, we need more robust data on scale and impact. Hard data is preferable over soft qualitative accounts. There's also the argument that the scale of voluntary action is insufficient to meet government objectives. So what this suggests is there's a mismatch between the real value of that voluntary action offers, the value that ChatGPT can find you in 5 seconds, and the value that government says it needs. And there's very little evidence of any utilitarian goals in terms of what the government wants for its people and through voluntary action. So I would argue this then leaves voluntary action locked into what I maybe slightly dramatically describe as the cycle of the tyranny of proof. What does that mean in practice? So this is a kind of an imagined exchange between a voluntary sector commissioner, a commissioner in the public sector and a voluntary sector organisation, where they say, tell me what the impact of your work is. And then they might tell them in a really nice kind of case study. And then they say, no, we need hard data. We don't need anecdotes. Public sector officials like to refer to qualitative research as anecdotes. So they go away and they might find a little bit more evidence. And then they say, yeah, but can you prove that you're saving the system money? They can't prove that they're saving the system money, particularly because it's technically impossible to save money in an austerity context. So then they come, okay, we'll fund you short term, but you need better data. And the cycle persists, and it creates a narrative which essentially says that the evidence base for the value of voluntary action is lacking, because we're locked into this cycle of wanting more, better evidence, which probably doesn't doesn't necessarily exist, or certainly can't be gained without investing significant amounts of money. So my conclusion here is that voluntary action has a value problem. There's an German economic sociologist called Jens Becker who does lots of research into the sociology of markets. And if we think about the relationship between the voluntary sector as the state, and the state being a little bit like a market transaction, he says that if you can't agree on the value, then you have a value problem and you can't trade. So the market fails. And I think the idea of a value problem, I think, is pertinent here. So the value problem is that the government isn't equipped to realise or acquire the real value of voluntary action when it's non-financial. This creates value dissonance. Nobody really agrees about the value, and it leads to market failure. In practice, that means that small local voluntary organisations struggle to access funding. They get crowded out by large providers. And that leads to organisations that are more fragile. It means there's less trust and accountability with the public sector. And those organisations have very little autonomy and control over their own destiny. So I want to kind of draw on a real world example of what that looks like in practice from my own research and research I've done over the last 10 years into the social prescribing policy agenda. So what is social prescribing? Very quickly, it's an innovation in healthcare, which is all about trying to connect patients in the health system with the voluntary sector. NHS England have this quite kind of neat visual model, which essentially is about employing a social prescribing link worker. And they sit on a pathway whereby an individual needing support is referred to, it goes to their GP or another trusted kind of healthcare professional who refers them to a link worker who has a what matters to you conversation with them. And on the basis of that what matters to you conversation, they're referred to a range of different kind of voluntary action based opportunities in their community. So far, so good, because in theory, what this does is it puts value and voluntary action at the heart of healthcare, and something I think we'd all advocate. And this is a quote taken from the NHS England website. So they say, in social prescribing, local agencies such as local charities, social and health services refer people to a social prescribing link worker. Link workers give people time, focusing on what matters to me, to co-produce a simple personalised care and support plan and support people to take control of their own health and well-being. So there's a value proposition there at the heart of that. It's about what matters to the individual, what's valuable to the individual is what social prescribing is supposedly all about. But I think this kind of concept of value dissonance is actually writ large through social prescribing. So social prescribing has an outcomes framework, of course it does, that the government has put forward, and that has three components. It has impact for the individual, impact on community groups, and impact on the health system. Apologies, these texts are quite small, but there's a lot to say. So in terms of individual, what they're talking about is well-being. That's good. They want well-being to improve. They want people to be able to better manage their health, to be more physically active, have better housing, debt support, be less isolated, things like that. Something, again, we think is, I guess we can all agree is important. In terms of impact on community groups, what they're really talking here is resilience. They want to see more volunteers. They want to see increased capacity to manage referrals from the health system. And they want to have improved understanding of what support is needed to make social prescribing sustainable. And then we have impact on the health system. So this is about reducing the number of GP consultations, A&E attendances, bed days, medication prescribed, and also reducing workforce pressures, because kind of there's a sense that the health system is overburdened and we need to get people out of the health system into voluntary action. What does the evidence actually say on all of this? So where is the value of social prescribing? So unsurprisingly, we have lots of evidence, quantitative and qualitative, that a social prescribing referral results in an immediate boost to well-being and quality of life. The impacts are likely to be greater and longer lasting if engagement in voluntary action is sustained. So there's a really strong case for voluntary action in social prescribing. On the community group side, it's a different story. There's real concerns that actually social prescribing has not been accompanied by investment in or support for capacity in the voluntary sector. Where capacity has been invested in, we've got some really good examples, including in Rotherham, where I've done a lot of my work. There's a really good example actually you can leverage much more resource into the system. So if you can invest in the sector, it's worthwhile, but not very many people do. And then the evidence base about the impact on the health system is wrought by data and measurement issues. The data is terrible. It's really, really difficult to measure anything meaningfully. We can see some small reductions in healthcare usage, but we can also see that many social prescribing patients are actually not high users of health and care services. So the potential for reductions is quite small. But then you see things written like this, and this is in an anonymous regional social prescribing strategy. I'm not going to say where it is. And they say that they want to invest in social prescribing to reduce health inequalities, making sure communities have access to support and advice, but they want to reduce A&E attendances, they want to reduce emergency admissions, and they want to release £3.8 million to be spent. This actually uses some of our research, and I don't know where they got the £3.8 million from, but I think it wasn't much more than that, literally working out on the back of a fag packet. And it's quite concerning that kind of so I guess once again, we're seeing the value of voluntary action essentially equated to how much money can it save for the public sector. And the well-being things are much less important. So where is social prescribing now? I know we've got a few people in the room that are quite active in social prescribing policy, and it is making progress. But I still think it's akin to trying to push an elephant up the stairs, in a sense that there's some really good people taking the policy forward, but they're facing lots of challenges about the evidence base. They're basically being said, if you can't prove to me that social prescribing is saving the health system money, then we're not going to invest in it. And we're facing this ongoing challenge. So the value of social prescribing is being equated to the value it creates for the health system, not the value for the individual, even though as we saw earlier on, at the heart of it is a what matters to you conversation. And what matters to most people in communities isn't how much money they're costing the health service. It's much more important things than that. So that's a real life example. I think it's probably a good point now just to kind of pause and just recap my argument, because I've kind of gone through quite a lot of stuff there. So first of all, the idea of interdependence. Voluntary action and the public sector need to coexist, mutually supporting each other so that they can benefit people and communities where need is greatest. The value of voluntary action, however, is wrought by value problems and value dissonance. The public sector doesn't fully recognise the real value of local voluntary action. Or perhaps another way of thinking about that, the value the public sector wants is not the value we're able to provide evidence for. So there's still a problem there. But perhaps more worryingly, I wonder if the public sector is actually systematically incapable of realising the real value of voluntary action. And when I say that, that's not meant as a criticism to people that work in the voluntary sector, in the public sector. I think there's loads of fantastic people doing fantastic work with the voluntary sector in the public sector, but there's something systematic going on that means it's not able to realise the value of voluntary action. And I think there's something here about value essentially has become something that is to be extracted, not co-created, and well-being is very much a secondary concern. If you go back to the 1970s, there was a kind of a fundamental shift in our economy, where we moved from a kind of an economy of producers to an economy of rentiers. And I won't go into the detailed economics of it, but essentially the move to the rentier model meant that there's a load of people that exist, people like Warren Buffett actually, who want to extract value from the economy rather than create value and co-create value. And eventually that narrative, it permeates everything, and it permeates our public services. And I think we can probably trace some of this stuff back to that and other things like kind of new public management ideologies and things like that. So surely there must be another better way, because hopefully most people can see some kind of there's a kind of madness here, I think, in the fact that the value of voluntary action is not being realised. So I wonder if there's something about looking back to look forward. I've managed, those of you who aren't academics or think that you've come to an academic lecture and you haven't been told about a book you can buy yet. Well, I'm going to change that in a minute. Don't worry. So voluntary action came to the fore during the COVID-19 pandemic, and I think we can learn an awful lot. And if you want to learn a real lot, you can buy our book. I hope you like what I did there, James and Chris and Rob. Which is seriously, what that book tries to do is capture lots and lots of evidence about what happened in the UK around in the voluntary sector during the pandemic, so that there is a resource there for people to learn from, and there's kind of 40 odd different contributors. And it was really a really enjoyable project bringing it together. What my own research during the pandemic, I guess, suggests is that the value of voluntary action became self-evident. We saw organisations of all sorts of different sizes, but particularly the really small local ones, showing up and then sticking around, supporting people when they were needed the most. Their work was focused on 4 main areas of need: access to food, addressing isolation and loneliness, providing information, and supporting people around mental health and well-being. And they were particularly effective tailoring their support for different groups experiencing complex social issues, often those groups that are most affected by health inequalities and who really struggle to access mainstream public services. We also saw, I think, kind of renewed and more equitable partnership with the public sector. All of a sudden, the public sector really needed the voluntary sector. Funding became less conditional. Power perhaps became more equal. I was speaking to a senior public sector person in Sheffield about this recently, and kind of we're reflecting on how do we learn the lessons from the pandemic. And what he said to me was really struck home, actually, because he said, actually, the reason why we could do all of this stuff is because we had permission from the government to break the rules. So for 12 months, we essentially broke all the rules that told us how we were to do to kind of deliver public services, and we did what we thought we needed to do to get communities and people through the pandemic. So I would say during the pandemic, what we had arguably was a shared, possibly utilitarian goal that we all could get behind, which was we need to keep the most vulnerable safe and well and make sure they don't catch COVID and don't die. There was also a narrative around we don't want our hospitals to be overwhelmed and things like that. But I think the primary driver was let's do what we can to make sure the fewest people possible suffer. And this is kind of writ large in this quote here, which is from our research for the Lloyds Bank Foundation, where they say this is a kind of a public sector person talking about the voluntary sector in Bassett Law, not too far from here, saying that the word that sprang to mind was values. What's the reason why they mean the small organisations were set up? It's to keep their community safe, alive and well. So they responded immediately. That's the value of small. Where in contrast, if you were the cogs in the chain of a large bureaucracy like the public sector, you just can't do it. So they're really kind of saying, actually, we really needed the voluntary action during the pandemic. But I think arguably that progress has been lost and the status quo has been returned. So we had a real opportunity to learn from the pandemic, to change the way we worked, and it didn't happen. So why was that, and what does need to change? Well, there's a kind of a really simple answer to this, which is kind of we need to end austerity. As long as we have austerity and we're not investing in our public services, then this is always going to be a challenge because there's not enough money to go around. But I think we also need to look beyond the politics of austerity, because some of these narratives existed before austerity. These are narratives that were coming out of the new Labour government in the 2000s. So they're not new narratives. They were just seized on and utilised by the kind of protagonists of austerity rather than actually developing themselves. So I want to propose that we need change at 2 levels, and neither kind of type of change is particularly easy, but I think we need to confront this head on. So first of all, we need a systemic change. We need change in the way that kind of public services work and the way the public services relate to and invest in voluntary action. I think we need to prioritise prevention. We need to think about how we address inequalities through a kind of approach characterised as proportionate universalism, where we identify the communities that need our help the most, and we make sure resources are kind of directed towards those communities. We need to remove silos and take a whole systems perspective. There's no use thinking about kind of what does the local authority do, what does the NHS do. They need to come together. What does the system kind of approach look like? And we need to devolve power and accountabilities to communities, because actually what we saw during the pandemic was most things that happened from the bottom up worked, most things that happened from the top down failed. So kind of let's learn from that. let's have more devolution of power away from Westminster to the lowest level possible. But then I think we also need epistemic change. And what I mean by epistemic change is a change in the way that we think about all of this stuff, changing the way that everybody thinks about this stuff, which is even more difficult. So I think we need a new value paradigm in the voluntary sector and in public services, which is about value as something to be co-created with people, not extracted from organizations. We need to change how we value things. We need to put individual outcomes before system benefits. We need to have well-being as a clear policy goal. We need to rethink how we think about evidence. We need to put qualitative evidence where appropriate on an equal footing with quantitative evidence. And we need to start managing trust in the way that we manage risk. Imagine, I don't know, anyone who works in a big organization nowadays, we spend our whole time having to do risk assessments about everything. Imagine if we had to take a similar approach to the relationships that were based on trust. What if we manage trust in the same way we manage risk? We might have a very different approach. So how do we get towards a consensus about the real value of voluntary action? And I think perhaps taking small steps, we can start to overcome some of the value problems and some of the value dissonance that I've talked about by coming to a deliberative position on 3 key questions. So everybody, different stakeholders coming together and say, when we're talking about the value of what it is you're doing, can we agree what we're talking about? The first question is value of what? All too often, actually, you find people are talking about cross purposes when they're talking about the value of voluntary action. We're talking about the value of an organisation, a service, a particular activity within that organisation. Really being clear about what it is we're talking about when we're talking about value. Then think about value to whom. So who is it that we want value to accrue to? Who do we want to benefit? And can we agree who needs to benefit? Can we talk about value for individuals and put that on an equal footing or a superior footing to value for the public sector? These, I guess, as academics, these are what we might call ontological questions, because they really strike at the heart of like, what is the thing that we're interested in? And then the third question is, how will we know and agree that enough value has been created? So if we can agree on these first 2 points, can we come together and agree what good evidence would look like? And I guess this is a kind of an epistemological question. It's a question about how we measure and extract our data. I want to conclude. So it may well have been a little bit of a Debbie Downer, some of that stuff, but I do want to conclude with some reasons to be cheerful. I think I like to kind of think about maybe kind of, yeah, where are the positives? I think there is increasing recognition that promoting well-being should be a priority public policy. David Cameron, bless him, remember him? He's got a lot to answer for, but he did have a clear vision about well-being and public policy. He just didn't get a chance to deliver on it, and I don't think he really understood that you can't promote well-being and have austerity, I think. Anyway, independent funders of the voluntary sector are actually leading the way on how you have some of these relationships, how you invest in systems, how you invest in organizations, how you invest in value rather than investing in services and activities. And there's lots to learn there. There's more and more opportunities for research funding between academics and the voluntary sector as co-problems. That might seem a bit of an odd thing to put here, but actually what that means is we can start researching this stuff together. And thinking about how to invest in the voluntary sector as research partners if we want to generate evidence on this. And a couple of really exciting projects that haven't come to fruition yet, but if they do, they're going to enable us to invest lots and lots of resources in the voluntary sector as a research partner, which is really exciting and is a real change in how academic research is funded. As I was kind of alluded to earlier, many people in public sector jobs, they do get it. I don't want this to feel like it's a kind of a critique of people that work in the public sector. I don't think it is. I think it's about the system that the public sector works in, and people in that system need empowering to work differently if we're to kind of maximize this. And then hopefully, possibly, maybe change of government in 2024 could present a chance to change how the state thinks about voluntary action, but I'm not sure at the moment, actually, it's really on their list of priorities. So I suspect even if we do have a new government in 12 months' time, there's not going to be a real change, but there's an opportunity there. So I'm into the final stretches now. I just wanted to share a few things about what I'm going to be up to over the next for my research, and they're kind of characterized in two broad areas of research that I'm going to be up to. The first one is around what I'm calling new directions for social prescribing. So we're just coming to the end of a really interesting, hard, long 2-year project for DEFRA and other partners about green social prescribing. And a lot of what I've talked about here has been informed by the time that I've spent with civil servants during that project. It's been really interesting and insightful. That's coming to an end soon, but with the potential to extend that. Just about hopefully to kick off a project with Active Travel England around active travel and social prescribing, hopefully taking forward some of the learning from the green social prescribing work. Also, we've got a project starting up now with Local Trust and the National Academy for Social Prescribing on the idea of community-led social prescribing. So what does it mean for social prescribing to be originated in communities and led by communities? And then also involved in a really interesting project with Dana Wellbeing. I'm really pleased that Wakas is here today because he's a co-investor on that project, where we're kind of taking a community-based approach to really understanding how social prescribing can contribute to healthy aging. Picking up the healthy aging theme, the other strand, I guess, is around healthy aging and health inequalities. So also this month, we've got a really exciting project getting started, funded through the UKRI Healthy Aging Development Awards, which is looking at taking some of the learning from our work around healthy aging and community organisations in Leeds and seeing if it can be applied in other areas. And we've also got a number of projects that we're trying to get off the ground with the health determinants research collaborations around in the region, including in Doncaster, which are really about kind of trying to put community at the heart of research in the public sector. I guess I should say thank you to some key colleagues and collaborators. As I said at the beginning, I really do believe that research is best done collaboratively, and I wouldn't be here talking to you without my kind of collaborators. And I guess first and foremost, colleagues at Sheffield Hallam University are really fortunate to spend my career in a centre like Fraser and more lately the AWRC, where kind of growth development opportunities are made available to researchers across all career stages. And that doesn't happen if you're in academia. We don't always get it right, but we're doing our best. And I think we still do a really good job of trying to kind of promote kind of research and development in a way that's collaborative. Tomorrow, I was really pleased to be able to give this talk today, because tomorrow at Sheffield Hallam University is the annual Voluntary Sector and Volunteering Research Conference, which is when all of the voluntary sector researchers from academia and practice from across the UK come together to share their research. And it's been a really important part of my career development as a researcher, has been to come to that conference every year, to share my research, to get feedback. And I also spent far too long organising it. I'm sure John will reflect. There's definitely a time limit to how long you should be organising that conference. So also, as I alluded to, a lot of my research is with the local voluntary sector, and I put Voluntary Action Rotherham and Voluntary Action Sheffield up there because I have done lots of research in collaboration with them, but also as a kind of a proxy for the rest of the local voluntary sector who I have collaborated with and I think are really important. Funders, I've been lucky to work with a number of different funders of voluntary sector organisations who've funded our research. They've been really important. And then finally, kind of other research organisations, other researchers, many of whom are here today to share this with us. Oh, and then not forget, there's a group of people on the front row here who I probably wouldn't be here without. Voluntary action has actually been a core part of my life from growing up. So a lot of you people know my mum ran a local voluntary organisation for a long time. She then retired and decided to chair another one, kind of stupidly, but also kind of volunteering in sports clubs and things like that. And kind of it's that grounding in voluntary action that has enabled me to kind of do the research that I do. So I just wanted to share a couple of final thoughts before I realise I've gone on a little bit too long, but some final thoughts, and then we can have some questions. So can this value problem facing voluntary action that I've talked about really be solved? And there's a really interesting quote here from John Maynard Keynes. He knew what he was talking about, I think. And he said, the political problem of mankind is to combine three things: economic efficiency, social justice, and individual liberty. And I guess the point I want to make is this is a really, really difficult problem that we're trying to grapple with. We do need our public services to be as efficient as possible. We do need to also make sure that they're creating value for the people that need it. Keating's understood that kind of way back when, and I think we need to reflect this is kind of difficult work, but it's important work, and we need to do give more thought to it, I think. So I said at the beginning, I have this kind of broadly utilitarian worldview, and then it kind of got me thinking, maybe we could start by rediscovering the utilitarian origins of our democracy, because we have a lot to kind of thank the kind of very early utilitarian thinkers like Mill and Bentham for, in terms of our social progress. And this quote, which is from a more contemporary utilitarian thinker, has really struck with me. So what Joshua Green? So what he said is, utilitarianism is not at the most fundamental level a decision procedure. It is instead a theory about what matters at the most fundamental level, about what it's worth valuing and why. It doesn't require us to constantly calculate the expected costs and benefits of our action. You might want to tell the Treasury that, because they spend a lot of time doing that. On the contrary, it requires us to trust our moral intuitions most of the time. I think there's something really important there about the solutions exist in people's experiences of their work, and we need to trust our intuitions, because that's more likely to serve us well than kind of constant moral calculation. So thank you.